How does my medical history lead to a correct bladder diagnosis? Understanding your medical history is like putting together pieces of a puzzle that help your healthcare provider see the full picture of your bladder health. When you visit a doctor with bladder concerns, they start by asking detailed questions about your symptoms. For example, they want to know if you notice changes in how often you urinate, if you feel urgency or pain, if there is blood in your urine, or if you experience incontinence. The timing and severity of these symptoms help differentiate between conditions like urinary tract infections, overactive bladder, or bladder cancer. Your past illnesses are also important. If you have had previous bladder infections, surgeries, or chronic conditions like diabetes or neurological disorders, these can influence your bladder function. For instance, nerve damage from neurological conditions can cause bladder control issues. Knowing about medications you are taking, such as diuretics or anticholinergics, is crucial because some drugs can cause bladder irritation or affect urination patterns. Lifestyle habits play a significant role too. Smoking is the leading risk factor for bladder cancer, so your history of tobacco use is vital. Occupational exposure to certain chemicals used in industries like dye manufacturing or rubber production can also increase risk. Additionally, your fluid intake habits can influence bladder symptoms and are worth discussing. Family history adds another layer of insight. If close relatives have had bladder or other cancers, it might suggest a genetic predisposition, prompting your doctor to consider more thorough testing. This could include urine tests to look for blood or abnormal cells, imaging scans to visualize the bladder, or a cystoscopy, which involves inserting a thin tube with a camera into your bladder to look inside. All these details help your doctor decide what tests are necessary and how to interpret the results. For example, if your history indicates a high risk for bladder cancer, they might prioritize urine cytology or imaging. If your symptoms suggest overactive bladder, urodynamic studies might be recommended to assess bladder function. In essence, your medical history guides the entire diagnostic process. It helps narrow down potential causes, ensures the right tests are ordered, and leads to an accurate diagnosis. This personalized approach is key to providing the most effective care. Remember, always be honest and thorough when sharing your medical history with your healthcare provider, as it is the foundation for understanding your bladder health and planning appropriate treatment or further investigation. For the best outcomes, consult your healthcare professional for tailored advice and management.